in this video, we're going to explore the areas of the body that benefit immensely from DMX. Well, it's done quite a bit for the cervical spine. There's a lot of things that we find in the neck, and that's really where this shines because so many injuries go undiscovered and are the root cause of a lot of symptoms and problems that people suffer from. But it's not just limited to the cervical spine. Sometimes we can do things in the lower back. It depends on the size of the patient because this is really calibrated for smaller body parts, but a very petite patient, we may be able to find some information for the lower back as well. But let's talk about other joints of the body, extremity joints, meaning pretty much everything else. TMJ, the temporal mandibular joint, that can be analyzed with digital motion x-ray. We can discover quite a bit with that. It's pretty amazing. The shoulder girdle, so this shoulder joint, okay, which is the glenohumeral joint. Then you have the AC joint, the sternoclavicular joint. So this whole joint in between in the collarbone, the scapular movement, the shoulder blade movement. That's something that can be visualized in detail. We can look at things in the knee precisely. We can look at things in the ankle, in the foot. We can also look at stuff in the wrist, fingers, and elbow. So all in all, pretty much everything can be visualized. There's protocols to go through as far as various movements so we can get an idea if something's going on that maybe has been missed on plain film x-ray, on MRI, or on CT scan. Great example of this, you know, patients we've seen that have popping and clicking and they can't really explain why it is. We can actually capture that real time. We can have someone move and recreate that popping, and we can freeze frame that and figure out what is causing the popping, and then be able to figure out very likely which ligaments are damaged that are allowing the bones to move excessively. And then there's no more guesswork. And I can't tell you how many people out there say, I have this weird popping every time I move a certain way and it hurts and it's causing me all these problems and no one can figure out what it is. And the reason is because all the tests that exist outside of digital motion x-ray, they're all static tests. They're all tests that do not involve movement, meaning these types of imaging do not involve movement to figure out what's going on. That's the biggest difference, is that digital motion x-ray has the word motion in it. We use motion to be able to visually analyze what's going on with how the bones move, and then we can extrapolate or we can assess what's going on with those joints, with the articulations. So that is an overview of what we can look at and what we can help with using DMX technology. So if you've suffered a neck injury, you need to schedule a consultation with us. Click the button below and find out if you have a hidden spinal ligament injury.
Video presentation by Meridian, Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic, and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian, Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.